Hey guys, this is pharmacist Curtis Alexander. In this video, I'll be talking about the antibiotic Zithromax. The generic name is Azithromycin. Just be going over what it does in your body, how it's dosed, spending a fair amount of time on the side effects, just give you my overall thoughts too at the end of this. So just as a reminder, have you taken it before, those sorts of things? Leave a comment. It helps me, it helps other people. So I'm going to hop right into it. All right, so azithromycin is what we would refer to as a macrolide antibiotic. Other macrolides are like erythromycin, so pretty big class of medications. How does it work? So bacteria have to replicate, and what azithromycin does is it goes in and blocks the protein synthesis of the bacteria. Now, what do we use it for? It's used for a lot of common infections. Ear infections like otitis media. It can be used for skin infections, strep throat, pneumonia, even with chronic obstructive pulmonary disease, COPD, the exacerbations that we can get with that, you can use it for that. Also used a lot in sexually transmitted diseases, gonorrhea, genital ulcers, those sorts of things. Okay. Now, how is it dosed? Usually what you're going to see with the Z-Pak or azithromycin is 2 tablets. They come in 250 milligram tablets for the most part. Usually 2 of those on day 1 for 500 milligrams, then 250 milligrams once a day for the next 4 days. Okay, so it's usually only a 5-day therapy. You can also take 2 of those tablets or 500 milligrams a day for 3 days. And then particularly in the sexually transmitted disease realm, they're much shorter dosing regimens, but much higher dosages. So they'll do 1 gram or 2 grams in a day and just treat it right away. Okay. As far as how it works and what it does in your body, it's absorbed fast. You get to peak blood levels within 3 or 4 hours. So it starts, people can start noticing that they're feeling better rather quickly with it. The one thing we are noticing is that we're starting to see more antibiotic resistance. Zithromax used to be given a lot just by itself, but now depending on how much resistance we see with certain bacteria, they may have to give it with another antibiotic. Okay, I want to spend a little time talking about the side effects. I'll mention some of the more rare ones. They're much less common and rare. And then we'll go into some of the more common things that you'll see. But let's start with some of the rare things you need to be aware of though, because if they happen, they tend to be pretty serious. First of all, we can see altered heart function. So if you have a history of heart issues, it's something to let your doctor know about. The biggest risk factors, females are at bigger risk, older age, and if you have a history of having low magnesium or potassium levels, that's something your doctor is going to want to know about. Liver injury has occurred. It usually does resolve or go away after 1 to 3 weeks after you stop the Zithromax. But again, history of liver issues, that's something you want to be careful with. Clostridium difficile is basically you can have an overgrowth of this bacteria, and it involves, it's pretty serious, pretty painful, diarrhea, kind of a nasty gastrointestinal situation. So we do see that, not common again, but can be seen. The other interesting one is we can see hearing loss and even ringing in the ears. Not totally sure what's going on there as far as how it's happening. But again, this is something that tends to be reversible within 1 to 5 weeks. If you start having those hearing issues, you'll need to stop it, and it usually resolves within 1 week to a month. Now, by far and away, the most common side effects with Zithromax are stomach side effects. When people would get it in the retail setting, you would just be like, listen, you take this with some food because you can have some stomach upset, and most people did. Now it says 14% in the studies for diarrhea and 7% for nausea. I would say those are close. I'm going off memory and personal, counseling people. It seemed to be a little higher than that, but that's what the study showed. The thing I want to point out You also have to keep in mind what dose you're taking. If you're taking that 500 milligrams a day for 3 days, your chances of the side effects go up, especially if you're taking it for STDs and you're taking that 1 or 2 gram. I can almost guarantee you, you're going to have upset stomach, nausea, maybe even diarrhea by taking this. So once again, I hope the video was helpful. Post in the comments, have you taken it? What was your experience? Did it help? Did you experience side effects? If so, let me know what those were. It helps me, it helps other people. Speaking of helping, I hope the video was helpful. And until the next one, I will see you. Thanks.